AIDS, or acquired immunodeficiency syndrome, is a serious disease that is developed from the wearing down of the immune system from the HIV virus, or human immunodeficiency virus.
After the first few weeks of acquiring HIV, people develop symptoms which may include fever, body, rash, sore throat, swollen glands, headache, upper stomach, joint aches and pains, and muscle pain.
After several months, many people start to feel better and not experience HIV symptoms for up to 10 or 15 years.
However, the HIV virus is still active and multiplying and infecting cells, which is slowly damaging the immune system.
When people's immune system have been extensively damaged, they are likely to develop serious infections known as opportunistic infections because their immune system cannot fight them off.
At this stage, patients are classified as having the conditions known as AIDS.
The symptoms of AIDS are basically the symptoms of the opportunistic infections developed.
These opportunistic infections include tuberculosis, did I say that right?
Yes, just keep going.
Pneumonia, and certain types of cancer.
The first recorded outbreak of AIDS consisted of 20,303 total recorded cases in 1985, a few years after its discovery in 1981.
In 1989, this number increased to 142,000 reported AIDS cases worldwide, with 100,000 reported cases in the United States.
In 1993, there were 2.5 million estimated AIDS cases.
By 2013, there was an astonishing 35 million people estimated to be living with HIV.
By 2013, there was an astonishing 35 million people estimated to be living with HIV.
HIV, which leads to AIDS, is spread when certain body fluids, including blood, semen, pre-seminal fluids, rectal fluids, vaginal fluids, and breast milk, are transmitted from a person with HIV to another person.
For transmission, body fluids must come in contact with a mucous membrane, damaged tissue, or injected into a person's bloodstream.
The HIV virus is usually spread through sexual behaviors and sharing syringes or needles contaminated with HIV.
Sadly, there is no vaccine to prevent being infected with the HIV virus, and there is no cure for AIDS.
However, there are many ways to prevent the spread of the virus.
These include using condoms during sexual activity, tell anyone that you've had sexual activity, whether if you are HIV positive, so that they can get tested prior to sexual activity, get both yourself and your partner tested for HIV, and never inject drugs.
If you already have HIV, take medicines and slow the progression of the virus to prevent AIDS.
These include antiretrovirals and are usually combined into antiretroviral therapy.
There is not any significant increase in the rate of death for people with the virus well controlled and treated.
However, when HIV is not well controlled, the mortality rate is 77% or higher.
In 2015, the United States had 39,153 HIV diagnoses, according to the Center for Disease Control and Protection. They reported 6,721 HIV/AIDS-related deaths.
Some interesting facts include that HIV uses camouflage by cloaking itself in carbohydrate sugar molecules, which tricks the body into thinking it is a nutrient.
There were two strains of the HIV virus. HIV-1, which has been traced back to chimpanzees, and HIV-2, which has been traced back to a small African monkey.
Approximately 30 million people have died from HIV, or AIDS, related causes since its discovery in 1981.
As you have seen, AIDS is a serious disease and you cannot stop the spread of its source, HIV. By using the prevention techniques described and spreading the word to people in your community, you can stop the spread of HIV.